My name is Maggie Janes-Lucas. I am the Chief of Party, or easily said director, of a USAID-funded project that focuses on collaboration and communication and learning among USAID implementing partners in Niger and in Burkina Faso. We don't focus on a specific technical area, although all of the areas that you may be thinking of important in West Africa or the Sahel, be it health, agriculture, animal, livestock support, water, etc. All those issues are under our purview, but we focus very much on the learning, adaptation, and then the communication of the results of those programs. So I've been in Niger for almost 3 years, and I've worked for Mercy Corps for about 5 years. And I've done quite a bit of work prior to Mercy Corps in HIV, AIDS, and malaria. I worked for Measure Evaluation, I worked for CRS, various other organizations. And then when I joined Mercy Corps back in 2015 as Senior Program Officer, I started covering just West Africa and North Africa. That was sort of the point where I really decided I wanted to stick in West Africa. So I moved to Niger to become the Deputy Country Director, and then this position opened up and I took it because it's a great, interesting project, and we wanted to stay in Niger a little bit longer.
We wanted to talk a bit about coronavirus and how the pandemic has impacted life in Niger, what you're seeing as far as the cases, numbers of cases, and how the population is coping with it.
Exactly. So, as you may or may not know, Niger is a landlocked country. It's one of the largest land areas in the world, although the whole country is not populated. A big chunk of it is desert. And it has a large population, over 22 million people, with a fertility rate of 7. I think it's the largest, highest in the world. And so the population is growing rapidly, plus the population is 70% under 25. So you can imagine that demographic scale. COVID-19, I think, really has been a massive shock for the population. I would say probably mid-March is when things started to brew in terms of people started to talk about it. We started to hear communications from the ministry, from the government. I was just, in fact, returning from leave in Europe on March 12th. And while I was at the airport, I got the alert that I was to be self-quarantined for 14 days because of my return. So my son and I quickly got home in our Mercy Corps car and were locked in our house for about 14 days. Which we gladly did, because of course we understand, and I think most of the audience, the Tulane community, understands the challenges of the health system that we have in Niger. And of course we want to be good stewards of what we're doing here and ensure that we protect the population. So we had been in an area, of course, in London and in France, where there were cases. And so we quarantined happily. Luckily, we didn't have any symptoms, but soon after that point, I would say about a week after that, schools closed. The government started making daily, every other day communications from the Ministry of Health. A couple of weeks after the schools closed, we also had a curfew enacted, and the curfew was 7 p.m. to 6 a.m. And then there were several measures that the government was taking, encouraging businesses, nonprofits, other agencies to close or remote work, if at all possible. Of course, that's a very challenging transition in a country like Niger, which doesn't have great internet and mobile phone connectivity. But many restaurants and services closed. Our offices, we have 2 offices in Niamey, and we have about 6 offices across the country, all closed to a certain extent. Our operations were still going, but we were asking people to either work in shifts, so there were only a few people in the office at once and 1 per room, have hand washing stations at every entry point and exit point, anyway, various types of actions as that. And as we've gone on, the Ministry of Health, I think, has done a very good job of communicating out standard messages. There's, of course, a national level task forces at the regional level. And every day there's a communication from the minister stating the number of positive cases, the number who were tested, and the number of deaths, number of recoveries, and those still undergoing treatment. So yes, the health system in Niger is quite fragile. Niger is a fragile state as well, but I do think in terms of communication, they've done a fairly good job in getting the word out. And I think for the most part, people were taking it seriously. I think the challenge is that the culture and society in Niger and West Africa in general is very communal. And extended families, generations of people live together in the same compound. And it's just not very well accepted to be on your own in general. So this has been, I think, one of the biggest challenges that my colleagues in the government, my friends around our neighborhood, in the communities where we work, just sort of everyone living here, even for us expats who've lived here for a fair amount of time, it's been very difficult because that's just not a typical way of life. So the distancing piece has been very hard. And then the restrictions on curfew. There have been some significant protests and rallies that have even turned violent in some neighborhoods, especially in the capital, because the start of Ramadan just happened about a week ago. Niger is about 98%, if not close to 100% Muslim. And so many, practically the entire population is respecting the Ramadan and fasting if they're able to. And so the issue really becomes that when sundown happens is when people eat, when people start to do their market shopping, when it gets cooler. It's been about 115 degrees Fahrenheit during the day here. So it's hard for people, especially if you're fasting, to get out during the day. So the nighttime is really when people kind of live their normal lives in a way, I guess. And so that was very difficult. And the last thing I'll say is that because of this, not only the curfew, but there have also been recommendations from the government, and the main Islamic association has agreed to close the majority of mosques. And that's another really important societal structure, especially during the month of Ramadan, where people get support and solidarity in fasting and sort of going through the importance of Ramadan. And so to not have that community structure open has really concerned people, and I think has driven a lot of the discontent.
Thank you. That's really interesting. Here in the United States, there are a lot of misconceptions that are floating around in social media. I don't know if you see anything like that in Niger.
Absolutely. Especially in the age of social media. Many people who are familiar with West Africa or Asia or sort of certain areas of the world where WhatsApp is quite prevalent. I mean, I'm on a bunch of different WhatsApp groups, from expat WhatsApp groups to local Niger WhatsApp groups to, WhatsApp groups with my family and friends back home in the States. And I would say at least once a week, if not 3 or 4 times a week, there are, on all of those different groups on WhatsApp, misperceptions and miscommunication myths kind of going around about COVID-19. And of course, they vary depending on who's sending it. But I think there's a lot of people, especially in Niger, who are saying, oh, it's the heat. That's what's saving us. It's so hot here. The disease can't survive. The virus can't survive. There's a lot of people saying also that, there are certain types of local remedies that you can take, that Africans somehow have a natural immunity. Those are just a few of the myths and misconceptions of what's, what the virus is doing here. But I've been actually shocked to hear in America, in Europe, I mean, in every country in the world, I think there are certain myths and misconceptions being spread. And that's really scary. Of course, we always see that with public health emergencies, I think, or different viruses or diseases. There's always, people have to figure out a way to explain that for themselves. And unfortunately, sometimes folks are led down paths of misconceptions. So we're trying very hard. I would say within Mercy Corps, within my consortium, within USAID, many other partners and donors, and the UN. The UN is doing an enormous job here in Niger. UNICEF, World Food Program, they've set up actually a triage center in the National Stadium for overflow when the National Hospital becomes overflowed with patients. So there's a lot that's happening, and there are a lot of television, radio. Radio is very important here because outside of the capital, that's how most people get information, is word of mouth or radio. And so through the radio, there have been lots of different campaigns and sort of brief educational shows about COVID-19, because really just trying to make sure that those misconceptions are squashed as soon as possible, although they will continue.
What about the health system? In some countries, there's been a real strain on the capacity of hospitals, especially patients needing intensive care. Are those types of services available in Niger?
Right now, as of today, we have just over 718 positive cases in Niger since they've been tracking, which was, I think, around the 15th of March or so. And among that, over 2,800 people have been tested. And among that, something like 400 and something have already recovered. And there's only been just over 30 deaths, I believe. So, that obviously is only the patients that have been tested and have been tracked. So we do believe, obviously, it's a much larger number. But at this point, I think the health system, it's struggling. I mean, the health system in Niger struggles on a regular day. There's one national hospital. There really aren't ventilators in the country. So if people are having serious, conditions related to COVID-19, they're not going to be able to be very well supported here. So I think the challenge is that the majority of people who are getting sick that we're seeing, at least in the statistics that the ministry is putting out, are almost all entirely over 45, 48 years old, up until early 70s. I think there's been one, if I remember correctly, one or very small number of people under the age of 45 who've actually been infected, and I think one who died. So we're seeing very similar statistics, I think, to what we're seeing in the rest of the world. However, the fear that I have is of course rooted in the health system here, which is understaffed, underfunded, and really just doesn't have the infrastructure to care for any critical or chronic cases. So that's why I think I was, very pleased and happy to hear that UNICEF had done such a great job of setting up sort of an alternate triage center at the National Stadium. The National Stadium closed about a month ago, and UNICEF put together a beautiful setup. I mean, tents, beds, I think it can fit up to 180 patients to triage and keep in non-critical cases who are still recovering. So as the system starts to get flooded, and I think the thing about Niger that is, I'm questioning myself, is that, have we hit the peak yet here in Niger? I don't think so. There have been some models that have been put out in the last week or two around different countries in Africa, and one of them that I saw said the peak was going to be in about a week here in Niger. So, I don't know. It's hard to say that. And I think it's hard because we also have such underreporting, and we're not even confident. Of course, we're confident in who tested positive, but we're only testing a very, 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 drop in the bucket. So
Right.
it's hard to say.
Right. So are there populations who are especially hard to reach? I don't know, rural areas or more isolated?
Yes. In fact, the country itself is only about 15% urbanized, meaning the population, only about 15% of the population are in urban centers. The rest of the population are in rural areas. And those areas vary from distance from about, 1,500 kilometers, 2,000 kilometers from the capital to, just 15 kilometers outside the capital. You're in a pretty rural area. The other challenge, I think, in Niger is the subregion of the Sahel that we're seeing is just this real uptick in the last couple of years of violence. Violence across the border with Mali, with Burkina Faso, and violence related to things from certainly terrorism, armed groups, to just intercommunal violence between farmers and pastoralists who are fighting over land access. And so, there are various levels of risk for the population. And so it does make it hard for, say, the UN or organizations like Mercy Corps to access certain communities because of that violence. There have, of course, been kidnappings and other things of expats, and there are certain areas where the government has asked expatriates or non-Nigerians not to travel. So it has made it difficult. I think that Mercy Corps and a couple of other organizations that we work closely with who are sort of bridging that divide between humanitarian work and development work and early recovery. We do work in some of these very hard-hit areas and have offices in those areas along the Malian border, along the Burkina border. And we have staff in those areas, and we are able to do some work around basic prevention and information. There are programs focused on social cohesion, and then there are programs focused on food security. We're entering, I think one of the most challenging things that I see here in Niger too is we're entering what is called the lean season, or the hungry season, right before the rain starts. And so people have exhausted their stocks of grain and food. And so many people are at the stage of coping mechanisms where they're eating maybe one meal a day, and trying to get ready to work in the fields, but looking for ways to sustain their families during this couple of months before the rains really start. And so obviously, given that, what we know about nutrition, folks are suffering, and it's making them absolutely more susceptible. But also it's just sort of a typical cycle within the Sahel that we see. And so we have programs that are doing food assistance, cash transfers to ensure that people do have access to food. Families, children can access some sustenance in the meantime, and at the same time get information and education about the COVID spread. We're putting up hand washing stations, tippy taps, everything you would think of at every event and activity we do. We're limiting large events, face masks are being used. And so there's quite a bit that we're doing, but I would say that again, as you get farther out of the urban areas, people very much, I think, have a hard time with the distancing piece. And so we're trying to really temper adjustment of our programs based on that.
Right. Well, thanks. So that's very interesting. Anything else that you want to mention that we haven't touched on?
No, I just think that it's a real pleasure to talk to Tulane folks again. I have a great admiration for Tulane. I'm definitely a happy SPTMH alumni, and the project that I run is a partner with Tulane School of Public Health. So it's great that we continue to collaborate even many years after I graduated. And I really encourage folks to get in touch. And if you want to know more about Niger, West Africa, the Sahel, or about the work that Mercy Corps, the Sahel Communication and Collaboration Project is doing, reach out to me or Nancy Mott, and we'd love to talk.
Okay. Well, thank you very much. This has been very, very interesting.